My name is Braden Rule, and I'll be demonstrating a lipoma excision. Prior to the procedure, the assistant nurse prepared the room and ensured that all necessary surgical equipment was properly set up and available. I begin by planning and marking where the excision will take place. I identify lesion margins by palpation. The lipoma can be felt beneath or may be visible at the surface. Once the margins are clearly identified, I mark the proposed skin for excision. Now I perform proper hand hygiene for at least 20 seconds. I wet my hands prior to applying soap and ensure that all surfaces are covered, including the palms, back of the hands, between the fingers, and under the nails. After scrubbing thoroughly, I rinse and pat dry my hands with paper towels and use the paper towel to turn off the sink to prevent contamination. I will prepare appropriate personal protective equipment. A surgical cap is donned prior to beginning the procedure. I then don a surgical mask and finish by donning sterile surgical gloves to maintain aseptic technique and prevent contamination. I cleanse the operative area using povidone iodine. The solution is applied in a circular motion starting at the planned incision site and moving outward toward the periphery. When adding the solution, avoid wiping off the marking lines. I inject 1 to 2% lidocaine with the nephrin. The volume administered depends on the size of the lipoma. I allow adequate time for the anesthetic to take effect. If the patient experiences pain at any point during the procedure, additional lidocaine is injected into the designated site. Any excess lidocaine is removed using sterile gauze. I place sterile drapes across the surgical site, beginning with the side of the patient closest to the surgeon, followed by the ends, and then the far side. This isolates the planned incision site from non-sterile surfaces. Depending on the size of the lipoma, I make a small incision directly over the lesion using a disposable scalpel. The incision may range from 3 to 4 millimeters for enucleation or up to 5 to 12 centimeters for large lipomas. I use surgical scissors and forceps to dissect the subcutaneous tissue from the tumor. I avoid unnecessary damage to surrounding structures and use the forceps to grasp onto the tumor while continuing careful dissection. Using forceps, I gently remove the lipoma from the excision site. The excised tumor is placed into a specimen container filled with formalin. The assistant nurse will confirm that the container is labeled appropriately to match the tumor's description, and then will place it into a biohazard bag for submission to the laboratory for histologic analysis. After setting my forceps down, I clean the inside of the wound using sterile gauze and saline, which is a salt and water-based solution. This step removes debris, foreign material, and bacteria, helping to prevent infection and promote proper healing. I will now suture and dress the wound. First, dissolvable 3-0 Vicryl sutures are used to close any dead space within the wound. The skin is then closed using 4-0 or 5-0 nylon sutures, which will be removed within 7 to 21 days depending on the body location. There are multiple different ways that you can suture a wound. For instance, in this video I am performing interrupted over and over sutures. Grasp the needle with the needle driver about 2/3 of the way from the tip. Insert the needle perpendicular to the skin about 3 to 5 millimeters from the wound edge. Follow the curve of the needle through the tissue and exit on the opposite side at the same distance from the edge. Pull the needle until you have a short tail, and then tie a square knot, usually 2 throws, then 1 in the opposite direction, and then lastly 2 again in the original direction. Finally, trim the suture tails, leaving short ends. Lastly, a dressing or medical-grade glue is applied to reduce the incidence of hematoma formation. You are now allowed to dispose of personal protective equipment and waste properly. I chose to demonstrate a skill in the field of general surgery because that is what I'm extremely passionate about. I love being in the operating room and getting to observe and participate in procedures where focus, skill, and collaboration come together to make a meaningful difference for patients. Thank you.